You're listening into ZJB Radio on 95.5, 88.3 FM and online at www.zjbradio.com. In just a little bit, we'll be joining the Montserrat the Government Information Unit, GIU, special presentation, officials of health, and they will be on air here on ZJB Radio and giving you information in terms of updating and keeping everyone informed as to what's happening in terms of health and the ministry on Montserrat during the pandemic situation, as well as other related issues. So stay with us here on ZJB Radio, and as soon as possible, we'll be joining our friends from the GIU, the Government Information Unit, here on Montserrat.
Good morning to our listeners and viewers. I am Fiona Alexander Smith, and today I'll be having a discussion with officials in the Ministry of Health regarding some new health developments as it relates to local COVID-19 testing, the arrival of the Cuban Medical team, and also general updates on COVID-19. With me today, I have the Minister of Health, Honorable Charles T. Kernan, Permanent Secretary, Mrs. Camille Thomas Gerald, Chief Medical Officer, Dr. Shara Greenaway Dubry, Director of Primary Health Care, Dr. Dorothea Hazel Blake, Senior Medical Technologist, Mrs. Kimona Daniel Bourne, and Medical Technologist, Monique Spencer. I'll say good morning to the team, hoping that they can hear me loud and clear. Good morning. Okay, I'm getting a signal that they are not able to hear. So just to let our listeners know that this is also being live streamed on the Government Information Unit on YouTube and also on Facebook. And there seems to be a slight technical glitch. But we are standing by and we're expecting to hear from the ministry officials who are in the studio getting ready to discuss the latest health developments as I just outlined. And lots happening in Montserrat. As I said, they'll be speaking to local COVID-19 testing, the arrival of the Cuban Medical team, and also general updates on COVID-19. For those of us on Montserrat, if you have been following local developments, you would know that on Tuesday, 13 health professionals from Cuba arrived on Montserrat, and that was based on a request from the Ministry of Health. So we'll speak to that as well. And as I said, we'll have general health updates as well from the ministry officials. That and more, those discussions coming up momentarily. listeners and viewers, and I'll do this introduction again. We had some technical glitches which delayed the start of this morning's presentation. I am Fiona Alexander Smith, and today I will be having a discussion with officials in the Ministry of Health regarding some new health developments as it relates to local COVID-19 testing, the arrival of the Cuban Medical team, and other general updates on COVID-19. With me today, we have in the studio the Minister of Health, Honorable Charles T. Kernan, Permanent Secretary, Mrs. Camille Thomas Gerald, Chief Medical Officer, Dr. Shara Greenaway Dubry, Director of Primary Health Care, Dr. Dorothea Hazel Blake, Senior Medical Technologist, Mrs. Kimona Daniel Bourne, and Medical Technologist Monique Spencer. Good morning. Good morning to all of you.
Good morning.
All right, and again, we do apologize for the technical hiccups this morning, but we're now ready and rearing to go. Exciting week for the Ministry of Health this week. We understand now the ministry is now in a position to conduct testing for COVID-19. So we're going to start with a discussion on that. And at first, I know the process has been a long one, so I'll ask you to explain the process the ministry had to go through to enable us to get to this point of conducting local COVID-19 tests.
Thank you, Fiona. First and foremost, the ministry had to undergo procurement of the analyzers, the equipment and supplies to facilitate the testing for COVID-19. Now, this procurement was supported by the Crown agents as well as Public Health England. After the procurement was completed, we would have had to undergo a series of training, and the training expanded from the use of the machine to the installation of the machine. We also had to do training on how to conduct the actual tests. So we had to do training for the SOPs for the testing, and we also had to do general laboratory biosafety training, because in order for us to ensure that we can carry out the training safely in the operational space that we have at the laboratory, we had to ensure that we undertook this training, and also we had to do a biosafety risk assessment. So that's procurement, then training. After the training and the biosafety risk assessment was completed, we then had to move forward with the verification of the testing. And what the verification does is basically to ensure that the machine is working as it's supposed to. So we would have received control materials and we would have run those. So we had to ensure that that worked. Then we also had to do trial runs. And after the trial runs, then we are now ready to launch testing.
All right. Thank you very much for that explanation. And it's so important for persons to understand what is involved in this process, because we know the equipment arrived some time ago and persons have been asking a lot of questions about that. So it's very good to have that type of details so persons truly appreciate what is involved. Now, in terms of the training itself, how was that conducted?
Well, as I would have said before, we had various trainings. So for the training on the use of the machine, as well as the installation of the machine, this was done by the company who provided the machine, that is the CEFID company that provided the Gene Expert machine. So those were carried out by CEFID. Then for the training in terms of how to carry out the procedure, the standard operating procedures, those we received assistance from PHE to carry out those training. And then for the laboratory biosafety training that was done locally, then Ms. Spencer, who is the designated biosafety officer in the laboratory, she's the one that would have basically facilitated those trainings. So Ms. Spencer, if you want to expound a little bit.
Okay, so as Mrs. Dan Banner-Bourne said, I am the designated safety officer for the laboratory. And this is not only for COVID-19, but for general operation of the laboratory, you need a safety officer who is there to ensure that everything, procedures and the general laboratory practices are carried out and maintained by the staff. So our safety included basic laboratory practices such as good hand hygiene, wear of PPEs. I also had to train our auxiliary staff. This includes waste management in terms of our orderlies and our housekeeping, because they would deal with the washing up of the equipment and so they had to know their role and how important it is for them in terms of keeping our labware clean to ensure proper testing and eliminate the risk of contamination within the laboratory. So training was done with the laboratory staff as well as our auxiliary staff as well. So these training included both theory and practical. So there's a lot of stuff we had to do, not only in theory, but in practical, show the washing up and those stuff.
Okay, great. And for those persons who may not know, can you explain what type of test it is? How is it conducted? What type of test is this one?
Well, the type of test that we're going to be doing is going to be done on the Gene Expert, and it is basically a PCR technique. And what PCR basically does is that it extracts the nucleic acids from the virus. So the nucleic acid is basically the actual makeup of the virus, right? So that is extracted, and then you have an amplification process and a detection process. And all of this is done within the cartridge on the module of the machine. So that's the type of testing that will be done.
Right, and I'm just going to ask you to just clarify things like nucleic acids from the virus and that type of terminology, those medical jargons, because the public would not really understand that. So just explain what that really means in terms of the sample and so forth.
Okay, so normally in the laboratory, you can receive different types of specimens. So people are probably more familiar with blood being taken. Now, when you do a blood test in the laboratory for viral testing, you're basically looking for antibodies. Now, if you would realize, the primary sample for testing is now a nasopharyngeal swab, which means that serological testing that can be used for blood will not be applicable. So this is a different level of testing. So that is why you require the molecular testing, such as PCR, to be able to test the nasopharyngeal swab. Now, the nasopharyngeal swab from a positive person is expected to have the virus on it. And the virus is made up of RNA, and RNA itself is made up of nucleic acids. So these are basically the smallest form of the virus. So basically like particles then, for lack of a better word. And that is what the assay is going to detect. So all of this takes place inside of the cartridge. So the PCR reagents and so forth will mix with these tiny particles, and these tiny particles will be amplified, meaning more of them will be generated. And then because of this generation, then you will have detection. Once it passes a particular threshold, a particular value, then you will have detection of these same little tiny particles that were initially detected.
Okay, thank you again, Kimona, for breaking that down for us here. And let's speak about the launch. Has the launch taken place, or what date actually is the launch for COVID testing on Montserrat?
Well, the launch of the testing actually occurred yesterday. So yesterday is a day where we definitely said that, yes, we are ready. All of the protocols and everything was in place as of yesterday for us to be able to do testing. At the moment, we haven't received any samples in the laboratory, but yes, we are ready to test.
Right, so as of Thursday, July 23rd, the Glendon Hospital Laboratory is in a position to test for COVID-19 locally. Now, when persons are tested, how soon will the results be available?
Okay. So the laboratory has a general turnaround time of 24 hours. However, because basically this PCR testing that we are implementing, it's a new system, and it will follow the normal algorithm we have for our serological testing. That is, all tests are done twofold, meaning it is verified by more than one kit or testing machine. At the moment, because there's only one operating system in place for COVID-19 testing at the moment, our tests will have to be forwarded to CARPHA, Caribbean Public Health Agency, which serves as our reference laboratory. So what will happen is we will give our 24-hour presumptive results while we wait for CARFA to verify the results we have are indeed what we say we have.
Okay, so when you say you will give that preliminary result, you'll give the patient that result?
No, this result will be communicated to the requesting doctor.
Okay.
That doctor will know, so it will not be issued as yet to the patient.
Right.
So the doctor will know the status we have while we wait for CARFA to confirm on that.
Right, so while we do know that we take 24 hours for the local results to be generated, it may take longer for the results to actually be given to the patient. And can you provide an estimate as to, I know this may change or fluctuate depending on caseloads and CARFA's caseloads, etc., but can you give an estimate as to the timeline for persons to get that verified result?
So it ranges from 48 to 72 hours, as I said, depending on CARFA's workload.
Right. Okay. So who will be tested? Can anyone request a test? What is the process?
Okay, I think that question is mine. Who will be tested? As our listeners know, initially persons who presented at a health center or called the hotline who had flu-like symptoms were the ones being tested. Now that we have an island capacity, we're going to expand that preliminarily. So anybody who has flu-like symptoms will be tested. The contacts, that is, the persons who are the close contacts of anyone who's confirmed with COVID-19 will also be tested. We are also offering tests to persons who may require a negative COVID-19 test for travel purposes. And those are the main preliminary groups that we will be testing at this time.
All right. And in terms of the cost, is there a cost associated with these tests on Montserrat?
You mean the cost to the patient?
To the patient.
At this point, there is no cost being asked of the patient at this point in time, but that's a policy decision that may change.
Right.
But as we speak, the ministry absorbs the cost for testing of all patients.
Right. So you've identified several categories of persons that will be tested or the test will be made available to. So we're not in a position where persons can simply request a test just because they want to know their status.
As we increase our testing capacity, because the public may recall that there was talk of different types of testing.
Yeah.
As we increase our testing capacity, that too will be expanded. So there's also the whole issue of persons in quarantine. We're working towards the point where everybody who arrives on island, once our borders are open, that there are several options on the table for consideration. And by the time we get to that point, we will make an announcement. But the idea is to offer testing to persons who arrive on island so that the quarantine period can be reduced for those who test negative, obviously.
Okay. Now, this is, very good news for Montserrat. So how important is this, in your view, for Montserrat to be able to offer this type of testing facility?
I think that it's definitely a milestone for us, Fiona, because we've definitely increased our testing capacity and our scope for testing. And what is even more exciting for us is the fact that the platform that we are now using will be able to expand on it and use it to do other tests in the future. So I think it's very important for us.
All right, thank you. Anyone else want to comment on that or no? Okay, so as we are speaking about testing as well, and Dr. Hazel Blake would have mentioned testing for travel purposes. We know that the Ministry of Health, based on a recent notice, would have indicated that persons would require testing for travel purposes. But since then, the information that has been circulated as coming out of Antigua is that a travel bubble has been established for persons across the OECS and including some other CARICOM states as well. Since that announcement was made, and the travel bubble, as I understand it, should have taken effect from July 7th. However, the ministry here is still requiring persons to test. Can you explain why this is the case?
Okay, I think I'll take that one, Fiona. It's not that we're requiring persons to take a test. What's been happening is that because there has been a lot of confusion surrounding the travel bubble and different countries have been changing their protocols in terms of what they're requiring for persons entering their countries, we are still offering the test to persons who are planning to travel, just to ensure that they don't have any issues when they get to those countries. So, for instance, Barbados is still requiring a negative test before you travel. And so the travel bubble, yes, it's there as a concept, but persons are still encouraged to check the countries that you're traveling to ensure what the requirements are for entry so that you meet those requirements. And if a test is one of them, we are offering that.
Right. Okay, and
Yeah, I think, can I just say something, please?
Sure,
Because
sure.
I've heard a lot of talk about this. It is not our requirement, it is the requirement of
the
the
destination
receiving country.
right.
What Ministry of Health has done is to facilitate that process. So the onus would be on the traveler to check with where you plan to travel to, find out what the requirements are, and then you contact the designated officer and we facilitate that process.
Because while Antigua, based on what you're saying, while Antigua is now saying we're in this travel bubble, the reality is that if you are going to be traveling on to Barbados or Jamaica or England or wherever else, that requirement may be needed at those destinations. And so it is essential for persons to ensure that they have that certificate nonetheless.
Yes, and I also think it's important to add that despite there was an announcement that says you contact Dr. Skerritt, I think was the announcement, and testing will be done on a particular day.
Yeah.
In an effort to facilitate the traveling public, that has even been extended. If you call Dr. Skerritt and you can't get a 7-day window that Antigua, for instance, had indicated, we were doing swabbing on additional days just to make sure that we were meeting the public's need.
All right, so we have been very flexible in terms of meeting the needs of the public. Persons also have to be aware of the route that you're traveling to get to certain countries, because for Jamaica, as an example, some people, they travel through the USA. So if you're traveling through the United States, you would have to have a negative test before you enter Jamaica. But because Montserrat is part of the travel bubble, if you're coming from Montserrat, they will say that you don't need a negative test. But because of the route that you took, you then required a negative test because of the exposure that you would have had. So persons really need to pay attention to where they're traveling to, how they're going to get there, and what is required.
Right. As I said earlier, this is very exciting news for Montserrat, but as we wrap up this part of the discussion, I'll just allow you to make any other final comments on the launch of the local testing COVID capabilities on Montserrat before we proceed to discussing the arrival of the Cuban Medical team.
Well, as Mrs. Daniel Bourne said, this is a significant achievement for Montserrat. The PCR platform is not just about COVID-19 testing, it's molecular-based testing, which means that we can test for a wide variety of viruses. HIV viral load is one of them. We can do influenza, tuberculosis, dengue. So, the possibilities are endless for Montserrat. This is something that we would have advocated for a few months before COVID became a thing. So we're quite excited, we're quite happy to finally have this available on island. It's definitely increasing our capacity in terms of our health system and what we can offer, and to support the health of the population.
All right, thank you. So this week as well, as I said, another major development for the Ministry of Health on Tuesday. The Ministry of Health and, of course, the entire Montserrat welcomed 13 persons, 13 health professionals from Cuba, and this was based on a request earlier this year. So that has been in the works for some time now, and in fact, we anticipated their arrival. Announcements were made previously about that. But I think it's important for the public to understand the process. So can you explain the process to getting us to this point of actually seeing the Cuban delegation on island?
Okay, I'll take that one. The process had to do with negotiations between the OECS, Office of the Premier, Ministry of Health, the UK government. So it involved several stakeholders. So that's the reason why it took some time to come to fruition.
All right. And explain to the public what exactly can they expect from the Cuban officials here? How will they be engaged by the Ministry of Health?
Oh, I think I'll take that one, Fiona. So the 13-member contingent, it's made up of 8 nurses and 5 doctors. So, of course, the nurses will be working in the nursing department. I'm sure persons are aware that we have quite a few vacancies in that department, and so they'll be providing support in that way. 6 of them are general nurses, registered nurses. The other 2 are specialized in intensive care. So if we have patients that require that level of nursing, they will offer support in that way. Also, the contingent is here to assist us with our COVID-19 response. And so if we have persons that require hospitalization or treatment of, well, the severe form of COVID-19, then they will offer assistance in that way. In addition to that, the 5 doctors, so we have an internist, an anesthetist, an OBGYN, and a pediatrician. So you know that we've been trying to get an OBGYN for a little while. We lost our pediatrician and internist, I think a year ago. We've been using locums to support that aspect of our healthcare system. And so the doctors will be shoring up that aspect of our system. The internist and anesthetist will be stationed at the hospital, whereas the OBGYN and the pediatrician will be working both at the hospital and in the district clinics. So they will be providing a lot of services. Women's health is a major aspect of healthcare, and so that person will be doing several clinics. We are very excited about this development and their arrival and the assistance that they will be offering to us. In terms of incorporating them into our system, we are aware that they're, well, the language barrier, but they do speak English. So it's just to make sure that they're familiar with our health system. So they'll be doing there's going to be an orientation program. We will be doing a tour of the health facilities, as well as getting them accustomed to our protocols, different paperwork that we use, etc. So that's how we plan to incorporate them.
Right, and you mentioned an orientation program and so forth. How long will they be on island for?
They will be on island for a period of 3 months.
And after that, is there scope to extend the arrangement with the Cuban officials?
The cooperation agreement between the government of Montserrat or the Ministry of Health, Montserrat, and the Ministry of Health for the Republic of Cuba includes a clause that allows us to extend as necessary.
Okay, that's good to hear. Now, Dr. Greenaway, in your response, you, of course, would have mentioned the support that the medical team will provide and the different areas in which they will be working. But just for the benefit of the public, because this question is asked a lot, I'm still going to ask you to explain to the public why it is important to still have the Cuban delegation here, even though Montserrat has gone through a period of not having an active case for about 2 months, and now we're at a stage where there's only 1 active case. There are some persons who are wondering if we still needed the delegation.
Yeah, so we still need the delegation. And this is because, so remember that it would be the same members of staff that would have been working over the 6 months that COVID has been a thing. So they need time off, so there's the issue of respite. We have a number of vacancies, which some of them, some of the Cuban members will fill. So that's adding additional support. And of course, we have to prepare for importation of other cases. COVID is going to be around for a while. And the better your system can prepare for its arrival, or re-arrival, if that's a word, the better. So we are trying to make sure that we have all of the resources in place. So that includes the infrastructure, that we would have worked on different isolation spaces. So now we're working on the human element of it, so the human resources that's required to treat patients, manage patients, etc. So they're still required. If you look around the region and the rest of the world, when they reopen their borders, there is a second wave, and in some countries a third wave that is expected. So we have to be in the best position to be able to manage that. At the moment, our borders are still closed, technically speaking. However, we have residents that are still returning, which explains why our quarantine numbers are still so high. We have persons that are coming on island, and once they go into a household on island that has other people, those people as well will be quarantined. So our numbers are going up. As you have persons coming on the island, you are going to expect importation of COVID-19 at some point. Look at the larger countries, the USA, UK, their numbers are skyrocketing, especially in the USA. And a lot of the persons that are coming to Montserrat are coming from these countries. So we are trying to make sure that we have everything in place so that we can manage if we have another epidemic, I should say.
If I may add, is that constantly we've been asked, the country has been talking about better health care. And one of the reasons why the health care might not be as good as it can be is because we did not have as the full complement of nurses. And so it's important that we understand that with this addition, it brings the complement up so that we can provide those services in a more proficient manner.
Yes.
The thing is that we have to understand as well, I think Anguilla, I'm not sure if they have only one case or if they even have any case at all. And they themselves have had addition to their nursing fold and their doctors. So does Cayman and most of the other islands, and globally, everybody is taking on the Cuban doctors as they're the best doctors and nurses as their best trained. So we are not singled out as if we are the only ones doing it. And I think it's important to understand that nurses are a scarcity in the region. And even here, as soon as you train a few, when the greener fields open, people move on because for self-betterment and otherwise. And we have to recognize that is why we need to have, it's important that we have the nurses here, the Cuban nurses, and we are happy that they were able to come, even it took a while to do so.
If I can just add one more comment to what the Honourable Minister mentioned. I know a lot of persons were asking why we didn't use our regular route to get additional staff. Well, if you look at the different countries around, they would have closed their borders as well, and they would have held on to their staff members to manage their own issues in their own countries. And so our regular route of recruiting locums, etc., would not have worked. And Cuba, this is what they do. They have specific missions. They're very experienced in dealing with outbreaks, etc. And so it's one of the methods that we chose, and it worked out, and we are quite excited and happy to implement this project.
Right. And that explanation puts everything into context, and I hope it certainly does for the listening public as well. We welcome the Cuban officials here, and we certainly appreciate their service to Montserrat. Any final comments from you regarding the support from Cuba?
We're just grateful for having reached this milestone. As you would have said earlier, this week has been a very significant week for the Ministry of Health. And so we are grateful for all the parties, all the persons who would have worked tirelessly in order to ensure that we were able to get to this point. So I just wanted to say that and express our gratitude to all persons who have been involved and who continue to be involved in the process.
It is also important that we remember that we always had a good relationship with Cuba over the years. I think some years ago, over the early 2000s, one of the ministers has actually gone to Cuba and different people. We have sent people to Cuba. We had one man session, as far as I know, maybe more, that have been trained as doctor in Cuba. So there's that relationship ongoing for quite a while. And they had offered scholarships at one stage to the OECS, which some Montserrat had benefited from. So we have a relationship with them, and we are hoping that this relationship will continue and can only redound to our benefit and the betterment of our services in the health system.
Absolutely. Thank you for that, Minister. Now, the ministry, as we now discuss general COVID-19 updates, the ministry announced a new case of COVID-19 earlier this month, earlier in July. Where are we now as it relates to our COVID-19 case numbers?
Well, I was here recently to announce the new case that we had. And I am afraid that I am going to have to announce again at this juncture that we have another case who is asymptomatic and somebody who has been here from March as well. So we now have two cases.
Okay. All right. So this new case was confirmed recently, yesterday? When?
Last night.
Okay, so we have one new confirmed COVID-19 case on island. And so the question that came from the first announcement, and I'm sure it's going to come again from this one, is regarding the fact that these two new cases have been here since March. Has the ministry, in terms of the investigation of the first case in particular, been able to obtain any answers as to how is it that this individual is now only testing positive for COVID-19?
Okay, Vivian, I think I'll take this one. In terms of, remember, so these two individuals would have been tested because they were going to travel. So they were not symptomatic. They would not have presented to our health facilities to be tested initially in March or later on. So it's because that we've been testing all of these other persons that we've discovered these two cases. In terms of the investigation, so there is a phenomenon where persons are shedding particles of the virus for a very long time. Mrs. Daniel Bond would have mentioned that the PCR test is able to detect these different particles of the virus. So it doesn't necessarily mean that they're shedding whole virus that will be able to infect other persons. They're probably shedding fragments. So there's emerging research about the number of fragments being detected via PCR versus, how contagious these persons are, et cetera, et cetera. The point is the PCR test is very sensitive, which means that it will detect the slightest fragment that is being shed by the body. Persons have been shown to shed the virus, particles of the virus for a very long time. Some persons 60 days, other persons, well, in our case, 120 days. And so lots of persons are interested about the cases that we're having in Montserrat now. We're getting a lot of attention from public health experts around the world. And so remember, it's a new virus, so we're still learning about it. What is important is that persons continue to practice the hygienic methods that we've been proposing for many, many months now, and to protect yourselves and to stay safe. And we are treating them as the persons that test positive, just like any other person that would have tested positive in the past, where they go into isolation, the household goes into quarantine. We have initiated contact tracing for this new case, and we will, the protocols are changing as we learn more. So now that we have the capacity to test on island, we will be testing close contacts, the persons in quarantine associated with this individual, et cetera, et cetera. So the investigation continues, both for the first case and this other case, and we will continue to update the public as we learn more.
Right. You did mention, and the ministry certainly over the past few months has been indicating that, this is a new case. There's a lot of learning and lessons being learned along the way. But of course, the public is still demanding and asking a lot of questions, trying to understand as well themselves. So regarding these two new cases, and just for the benefit of the listening public, Montserrat now has two COVID-19 cases, one, which was confirmed earlier this month, and that was previously announced, and the Ministry of Health has just announced that we do have another positive case on Ireland, so that's 2 cases on Montserrat. Both individuals are individuals who were here from March of this year.
Correct.
Now, you introduced some new terminologies that we're now hearing, things like shedding of particles and so forth, and based on your explanation, is it fair to assume that these persons would have been positive all along and are not, and just wasn't able to transmit the virus? Because you're saying contact tracing has started with the other individuals and the contacts were negative.
Yes.
Can you explain that? Lots of questions.
Yes, I know. So, right. So if you go back to what Mrs. Daniel Bourne had explained earlier about the RNA that is present in the virus, that's like DNA. Most persons are more accustomed to hearing DNA. That's what we have as humans in our cells and so on. So viruses have RNA, right? That's their genetic makeup. That's what, well, some of them. Some of them. This particular one has RNA. So basically, the virus, the RNA will tell the human cell to make more of the virus. That is the virus infecting the human body then. What the human body will do is react to this virus, and it will break it down. It will try to kill it, for lack of a better term, right? Mm-hmm. And it will break down the virus into particles. The PCR test, basically what it does is detect these particles. So the body breaks down the virus, it detects the particles. So the body is shedding the particles of the virus then. And that is what the PCR test will detect. So that does not necessarily mean that the person is contagious, the shedding of the particles, right? But as I said, this is new information. It's just emerging, which is why I said that the ministry is still investigating, because we are having ongoing discussions with our colleagues at Public Health England, and they too are learning more about this virus, and we're working together to develop protocols that make sure that the public remains safe and that we can treat patients in the best way that we can. So it's not something that we are in a position to fully explain at this moment, but I hope that that would answer a lot of the questions that are being posed at this time.
Right. And the question as well that the public would ask is whether or not there has been any connection between the 2 cases. Do you know?
We don't know that yet. I strongly suspect the answer would be no. We literally got the results for this, what I'm going to call patient number 13.
Late last night.
Last night.
Late last night.
So as I'm sitting here, a member of the contact tracing team the work has started. So later today we'll have more information, but based on what I do know about patient number 12, contact has been limited. So I would hazard a guess and say that the 2 are not connected in any way.
Right. Well, I know you can't at this point give a definitive answer to this question, but it's just worth acknowledging the fact that the 2 patients were asymptomatic and the whole conversation around the shedding and so forth. Is there any research that may be suggesting that asymptomatic persons are not able to spread the virus?
Yes, there is.
Okay.
The WHO has publications because you remember when COVID became the new star, one of the main concerns people had was that people who don't have signs and symptoms can spread this disease, and that still continues to be so. But the studies have shown that the contribution to the spread made by people who are asymptomatic is extremely small. Because think about it, if we're saying it's being spread through droplets, it's when you speak, when you cough, when you sneeze, then if you are not doing any of those things because you have no symptoms, the only thing you're doing is speaking, the amount of droplets you generate will be much less. And so the risk of spreading is reduced. And certainly patient number 12 seems to suggest to us that they're on the right track, because we did complete contact tracing and we did test the contacts of that individual, and all of the contacts including persons who lived in the same house, tested negative.
Right. And based on what you're saying here, it's definitely important for persons to clearly stay at home if they're feeling unwell, if they're experiencing any of the symptoms. And that is a key message that the ministry has been emphasizing throughout.
That is a key message, but there's another one that I want to remind us of.
Tell me.
Face covering, social distancing, the same messages we gave from the beginning. Because if you see somebody who's symptomatic, if you go somewhere and you see people coughing and sneezing, most of us are sufficiently concerned now that we will keep our distance. So you will say, why you don't go home? But I could be sitting right here, I'm sitting next to the minister, and he has no signs or symptoms, hence why we're sitting here wearing a face covering. Because in all of this conversation, all of these answers we've been giving to you, we're generating particles, whether we like it or not. We're generating droplets, rather. So if either of us was infected, then you would have increased the risk of spread to the person sitting on your right, on your left, to him who's sitting across from me. So when we encourage people to wear face coverings, it is because we are particularly concerned about those who may be having asymptomatic infections, meaning an infection with no symptom. And if those persons, and we who think we're healthy as well, who wear face coverings, if you're going to be in close proximity to others, then you reduce the risk of spread.
Yeah. All right. So now that we have 2 cases, I know we'll have other updates as the ministry continues their investigations into these cases.
If I may, based on the infographic that went out yesterday,
Yes.
so we can change that to say we now have 13 confirmed cases.
Yes.
Persons tested would go up to 120 because we would have had 11 pending results. So you have to add 10 to that, so 120 persons. And we have 2 active cases. We have 0 cases pending as we speak and 0 hospitalizations. In terms of the quarantine number, though, that number will change, as I said, sometime later today once the team has completed their contact tracing.
Right.
And that number is updated.
Okay. So as we're on the issue of, or the point of quarantine numbers, it is important for persons to understand what will influence the change in the quarantine numbers as we go along. So just explain to the public, because there are times when, even with the 1 case that we had up to yesterday, you see the numbers and persons are trying to understand and analyze the data and make sense of the quarantine numbers. So explain how the ministry goes about putting persons into quarantine.
Well, most of the persons in quarantine right now are persons who have either arrived on island or their household members. Although the borders are closed, I think Dr. Greenway said earlier, for the last couple of weeks, at least 3 times a week, there are flights. People are coming home. There are Montrealans returning home, or Montrealans coming home for a visit. And so the protocol is, if you come on island, clearly you are in quarantine for 40 days. If you're coming to stay with friends and family, your friends and your family who live in the same household are also quarantined. So just before the contingent arrived, we would have been about 28 persons in quarantine. And then you add the 13 Cubans. You see how quickly the number increases. And then we had, 1 or 2. Now, as we speak this morning, there are some people who will be released from quarantine. Some persons will be added by the end of the day. So the numbers changed. And since I have your ear, let me say 2 persons on the ground to consider. If your cousin, your sister, your brother calls to say, I'm coming home, I want to come for 2 weeks, I want to come for a month, take into consideration your living arrangements, because chances are you too will be placed in quarantine. Some people get very upset when we explain that to them, but think about it. If somebody's coming from the United States or the UK or one of those countries with high prevalence, the risk associated with that person is high. So you move into the house with the rest of your family, you're mixing and mingling, sitting down and chatting, having breakfast, having lunch, all of that, you are now exposed. So we are requiring that the entire household be quarantined. Unless there is a situation, for instance, where there's an upstairs and a downstairs apartment and the person is staying downstairs, the requirement is for the entire household to be quarantined. So that is something worth considering.
All right, thank you for that. Now, I just want to follow up on a point that I think Dr. Greenaway, you spoke about in one of your responses, and that is the area of isolation units. And I know the ministry was doing some work on the homes in terms of transforming those into isolation facilities. Can you provide an update as to where we are, where that is concerned, especially now that we're seeing that we have another case on island?
I'm going to allow the PS to answer that question.
Okay, we have 2 isolation facilities. We would have earlier, very early following the onset of the first set of, prior to the onset of having our first set of COVID-19 cases, we would have converted our physiotherapy unit into a 6-bedded isolation facility.